Good morning. I promise I've been alluding to it for a few months now, and here today's the day. This is the start of the series, very personal story for me. And I'm going to make full disclosure. My husband is a very private person. He doesn't like me talking about him on this show. But what I said to him is by sharing our experience over the last several months, we can help somebody else. And what I learned in these last months is the way that insurance companies and doctors play us, the customer, their patients, off each other. When they talk to you, the insurance company will side with you. Same thing with the doctor's office. They'll side with you. Oh, yes, ma'am, you're right. And then they turn around and completely screw you over. And that's what happened to us. I also want to say with full disclosure, in case somebody who knows us personally is concerned, I will tell you that after everything we've been through since December, that my husband has a new doctor now, and he just got very good news from his latest lab results, and he is absolutely fine. He's fine, okay? Although I am going to do a show about diabetes and the numbers and what they mean in certain situations, because it's very confusing, and I'm going to try to break through some of that confusion, but that's a future show. So it started in December, and with the Affordable Care Act and the fact that my husband is not the kind of person that goes to the doctor, we're very blessed. We have good health, and we're like, well, if it's not broke, don't fix it. But I said, you're getting a little older now. You're going to be 50 next year. Why don't you get an annual exam? You're not going to pay for it. That's what I said. You're not going to pay for it because the annual exam, the Affordable Care Act, says you get an annual exam once a year at no cost out of pocket to you. So I said, that's a good idea. I have this new insurance now with my job, and lower deductible, and I won't have to pay anything, so I'll get the exam. Okay, so he schedules it, and the doctor said, okay, come in for blood work a week before. Again, hadn't seen my husband. Sal Levanti Cotter is the family practice. Dr. Cotter had not seen my husband in 3 years. When my husband scheduled the appointment, he said, I want an annual physical. So he went in for the blood work, and it was funny because the nurse said to him when she drew the blood, well, what are we testing for today? He said, well, whatever's covered under an annual exam. Didn't the doctor order blood work? So they took his blood. He went to see the doctor. He had an 8 o'clock appointment with Dr. Cotter. He went in, and Dr. Cotter, unlike 3 years ago, where Jason had gotten a copy of his lab work and the doctor went over every line, this time the doctor just basically looked at a computer and said, well, your A1C is 11.4, which is diabetic. It's high. So here's what we're going to do. Here's a prescription, and you come back in 3 months, and we'll test your A1C again. Watch what you eat, exercise, take the prescription. I'll see you in 3 months. Have a good day. I know this because for some reason, which usually doesn't happen, my husband called me when he got in the car to go to work from the doctor's office. He said it was 8:20 a.m. So the doctor visit was probably 15 minutes because the nurse sees you first, weighs and measures you, all that stuff, and then the doctor comes in. So basically 15 minutes with this doctor. And he said, yeah, he gave me a prescription. I said, what prescription? He said, metformin. I said, well, he told me how to take it, and then I'm going to go fill it, and I'll see you tonight. Love you, bye. So I'm like, okay. So that was the minute where I became an unpaid person who has a full-time job. I Googled metformin, okay? And what I found about metformin is that the first thing it says is when you are taking this prescription, you should be testing your blood sugar at least twice a day, first thing in the morning and 2 hours after dinner. So I text my husband. I'm like, did he give you something called a glucometer, which is a blood testing kit, and show you how to use it? He said, no. I said, well, this drug says if you're taking this drug, you need to do that. So he called the doctor back, and the receptionist took the message. Nurse calls him back and says, Dr. Cotter said, don't worry about it. You don't have to test your blood sugar. Okay, big red flag went off in my head. So I got on a discussion page on Facebook with other diabetics. And I said, well, my husband's doctor is saying he doesn't need to test his blood sugar. They're like, excuse me? That's ridiculous. And so I started hearing their stories about the day they were first diagnosed with diabetes. And they said, well, we were in the doctor's office for an hour and a half. The doctor told us to get a glucometer. He showed us how it was used. We were sent to a dietitian. We were given menus and food options. And I said, no, none of that happened. And so then I started getting comments from these people on this page saying, you need to fire that quack. This doctor is not treating your husband properly. Not like other diabetics are being treated. So I was very concerned. So when my husband came home that night, I said, I just found out, I did all the work, I was online all day. You can get your own glucometer. You can go ahead and buy a blood testing kit on Amazon. So he did that. Now, right there, cha-ching on us. If Dr. Cotter had prescribed a glucometer for my husband at the time of his visit, it would have gone through our insurance company, and the insurance would have paid a portion of the glucometer. But because the doctor didn't prescribe it, we had to pay the entire amount out of pocket. And Jason had to teach himself how to use it, which isn't as easy as you think. It's not just stick your finger and bleed on something. He wasted a couple test strips because it wasn't working, and he had to keep doing it again till he finally got it down. He basically came home and said, I can't eat pasta, rice, potatoes, bread. I said, wait a minute. What can you eat? Lima beans, lettuce, tomatoes. I can't have ketchup. I can't have barbecue sauce. I don't want to eat red meat. I'm like, whoa. Who told you this? He said, well, I Googled it. I'm like, no, wait a minute. This is bullshit. You can't live like this. I mean, that's ridiculous. That's an anorexic diet. I know, because I was anorexic. So I started Googling diabetic menus and books on diabetes. And I found an author, and this is a great book, by the way, if you are diabetic. And again, I'm telling you right now, if you know us, my husband's fine. Just had new blood work done. His A1C is now 5.9, down from 11.4. And by the way, this is also a future show for Thursday. He stopped taking that metformin shit, that crap. He stopped taking that within 6 weeks. So he lowered his A1C with diet, exercise, and no medication and supplements. That's Thursday's show. We're going to talk about that. So I found this book by a Jason Fung. It's called The Diabetic Code. I believe that's what it's called. It's a fabulous book. My husband paid out of pocket and bought the book. And it was very informative because in the book, Dr. Fung talks about spikes in blood sugar overnight, like why your fasting blood sugar is high, but your after eating blood sugar is normal. Very informative book. It's a great book. I strongly recommend it if you have recently been diagnosed with diabetes. And if you're like my husband's doctor, Dr. Cotter, who basically just says, here's the script. But here's the bottom line. 20 minutes, maybe 15-minute visit. In the time it took to write the script, all of a sudden, my husband's annual checkup visit, Affordable Care Act covered visit, all of a sudden turned into an ill visit. And I only found that out in January when I received an explanation of benefits from my insurance company, and there were all these amount you owe for the blood work that was taken a week before the doctor even saw my husband or saw the results of the blood work, and for the office visit. Turns out Dr. Cotter overbilled this office visit by $146. And the $146 overbilling meant that we had to pay a portion of it as a copay, like $49.80. And I'm like, wait a minute. And then there was another copay for the drawing of his blood, like $6. I'm like, what? Remember, when my husband got his blood drawn, it was for an annual checkup. And yet when I called the lab and said, why am I getting billed for a portion of this blood work? They said, the doctor, Dr. Cotter, coded it as general illness. Why would he do that when my husband said he was coming in for a routine physical? He hadn't seen Jason in 3 years. Jason did not complain of any aches, pains, illnesses when he made the appointment. Why would he, before even talking to my husband or seeing any lab results, code that blood work as general illness? The lab said you got to call the doctor back and tell him to change the code. And they usually do. They made a mistake. Then I see that so I called the doctor's office. I called. And then I had to wait. I explained the issue. Okay, someone will get back to you. I waited a week. Then I waited 2 weeks. Finally, I called again. Okay, she'll get back to you, the nurse. And finally, a nurse called me. Her name was Karen Meck. And when I explained the situation, especially with the blood work, she said, oh, I agree with you. Yeah, she said, send me a copy of this explanation of benefits. Do you have a fax machine? I said, well, my husband's at work. I'll ask him. Husband comes home from work for lunch, and I say, she wants us to fax her. He said, I don't have a fax machine. I call the doctor's office. I talk to the receptionist. Can I email it to Nurse Meck? Yeah, here's her email. I email the explanation of benefits. And I wait, and I wait, and I wait, and I wait. And then I call again, and I'm like, why am I not hearing back from her? And the receptionist says, oh, she's on, let me talk to her a minute. And the nurse, the receptionist comes down and says, she never got it. I said, I emailed it to her. The next day, I get an email from Nurse Meck going, sorry this took so long. I never checked my email. Isn't that interesting? Then why would the receptionist tell me to email you? And why wouldn't that receptionist tell you that you should expect an email from me? This was important. So she sends me a copy of this letter after she told me she agreed with me, the coding was wrong, it was an annual checkup, blah, blah, blah. She sends me a copy of what she sent to my insurance company, and she's basically telling the insurance company that at the time of the office visit, Mr. Luciano was diagnosed with diabetes. He had a very thorough, lengthy physical exam from Dr. Cotta to educate him on living with diabetes. What? What? I blew a gasket. I called the insurance company on the phone. I said, I'm looking at this letter, and everything that woman wrote to you is an out-and-out lie. I said, no education was given. I said he wasn't even given a blood testing kit. How can she say this with a straight face? She lied. Completely lied. They said, well, ma'am, you can appeal the bill. And in fact, we urge you to appeal the bill. We agree with you. Again, they're talking to me. They agree with me, right? They tell me how to appeal it. And now I'm still dealing with a bill I haven't received yet, which is the bill from the doctor's office for the $49.80 plus the drawing of the blood. And so before I even got the bill, I said, well, it's funny we never got a copy of the lab results. You'd think the doctor would have given him a copy. But then I saw on the bill we had gotten from the lab that you can call to request the results. So we did call. We called LabCorp. They're great, by the way. And 2 days later, I had Jason's lab results in my hands, in my mailbox. And I went over and I thought, wait a second. You know, Jason's been saying he has like some burning in his legs and some numbness in his feet and weakness in the muscles in his legs. And here, one of the things that was flagged by the lab was actually something many people suffer from, okay? And it's basically a B12, vitamin B12 deficiency, and it can be caused by anything from anemia. It's usually not that big of a deal. You just have to take B12 supplements, or some people even get a B12 shot once a month or every couple of weeks, whatever. But the interesting thing is, remember how the nurse wrote to the insurance company that he had this thorough exam? Dr. Cotter never mentioned that the lab had flagged that B12 deficiency to my husband. And when you Google the B12 deficiency, guess what? Jason has the symptoms of it. That's the symptoms. And yet Dr. Cotter just assumed he saw the A1C was high and he zeroed in on that. I can write a prescription for this, not a supplement, which is what a B12 deficiency requires to take care of. I'll write the script and, oh, the diabetes is probably causing the leg pains. Problem is, I can't find anybody, at least the people I've talked to with diabetes. While you can get something called diabetic neuropathy, it's very rare to get it when you're first diagnosed. It's not usually your first symptom of diabetes. Your first symptom is thirst and excessive urination, which my husband had none of. Never had that. Which is why, once again, he did not go to Dr. Cotter for this annual exam because he thought he was diabetic. He went for an annual checkup. Which is why it is so baffling to me that before even talking to my husband, he was already being considered coming in for an illness visit instead of an annual preventive checkup. And I don't know how much more clearer you have to make it when you're scheduling your annual exam. Do you have to say, I want the annual exam that won't cost me anything out of pocket? Give me that one. Tell me how you're going to code this in advance so I can call the insurance company and make sure you're not going to screw me like Jason and I were screwed by Dr. Salavanti and Cotter Family Practice. The nurse even let it slip that the reason that we were overbilled and, in my opinion, underdiagnosed, because they didn't mention the B12 and they didn't give Jason any education on how to live with diabetes, what to eat, no dietitian, no testing supplies, just the script, and we'll see you in 3 months. And for that, that's an educational visit? Considering that I did all the work, that we paid out of pocket for the testing kit, for the strips, for the books. Are you kidding me? And then I had to go in and research this B12 deficiency that the doctor forgot to mention, which the lab had a flag next to it. This is high, which means there's a deficiency. So I called the doctor's office and I talked to the receptionist again. And I said something was missed on my husband's lab work. And to me, it seems like it's important. All right, I'll have someone call you back. So the nurse did call me back. And she said, it's not a big deal. Not a big deal. It wasn't all that high. I said, okay, well, you know what? I'm sorry, but I'm concerned about this. And she basically just said, don't worry about it. I said, well, by the way, I don't appreciate that letter you wrote to the insurance company. And I am going to tell you right now that when I get the bill from your office for the office visit, I'm going to appeal it. I want you to know that in advance. I don't think it was coded properly. And so that was the last conversation I had with the nurse. But I'm going to leave you with a cliffhanger today, because I've given you a lot of information. I did get another call from Dr. Cotter's office, and it was from the big man himself. And at first, I didn't quite understand the reason for the call. But what happened next? Well, now I get it. And it'll make me very, let's just say, hesitant to ever pick up the phone when an actual doctor is calling me, because he had an agenda. And it was just more lies and a way to try to get the $58.30 out of me and my husband. It was a way to cover his ass. And that's Thursday's show. And I hope you'll stay tuned. And please remember this. An annual exam is supposed to be a time, you see the commercials all the time, you're supposed to be able to talk to your doctor about anything that's going on. There's a lot going on right now. They say if you're feeling depressed or you have a question about your mental health, talk to your doctor during your annual exam. And yet in this situation with this family practice, it appears that the only time it will be coded as what it actually was requested, an annual checkup, a preventive checkup, is if you pass with flying colors, if there's absolutely nothing wrong. The second something gets flagged on your lab results, or you dare to say to the doctor, you know, I haven't been feeling real good lately. I'm a little depressed, or I get acid reflux a lot. The second you say what everybody tells you to say, if something's wrong, if something's not feeling quite right, I mean, it's not serious enough that you're going to call in the middle of the year, but when you're there, the doctor's sitting there, you tell them. That's what the annual checkup used to be about. But with this family practice, and believe me, I've been on their website, and I've seen their reviews since UPMC Pinnacle bought them, and they're now owned by this corporation. And their reviews have gone from very good to horrible. Most reviews are saying that these patients are finding new doctors because of overbilling, long waits in the waiting room, and not being able to get anyone on the phone to talk with them when they have questions or issues. Same thing that we were going through. So I'm not the only one. And I'm not just trying to throw this practice under the bus, because many practices do the same thing. And you have to be very vigilant. You have to interview a family doctor now the way you would interview a babysitter or a dog sitter or an employee. You have to make the doctor understand what you expect from them. Because after all, you are the one who is getting overbilled and possibly underdiagnosed. And the only reason you will know that is if you have the time, as I was blessed to have, to actually check it out, to investigate. And that's what I spent this winter doing. From January 11th till the second week in March, when I got the results of my appeal process with the insurance company. So Thursday, we're going to discuss the prescriptions versus supplements and our personal experience with that situation. I hope you enjoy this series, and I really hope you will comment and share your own personal stories with me. And if you happen to live in Lancaster and you're seeing a really great doctor that is always there for you and doesn't overbill you and is pretty thorough, let me know. Although, thankfully, Jason now has another doctor, a really good one, came highly recommended by a doctor friend of mine that I went to school with. And I appreciate him taking his time to speak with me on a Saturday and to recommend this new doctor. So far, we're very pleased. And as I said, the new lab results have come back completely fine. So we're blessed about that. So have a great day. Remember, I'm trying to do this for you, to give you the education that hopefully will help you out, that if you see something going on with your own family doctor, you will think, wow, Political Paula talked about that on her show. I better be vigilant. You should always be vigilant. Because unfortunately, there are some doctors out there that care more about the bottom line because the corporation that owns them cares more about the bottom line. And remember this, UPMC Pinnacle, the owner of the family practice my husband went to, they don't know us. They don't care about us. They didn't take a pledge, first do no harm, like the doctors do. They only care about the money generated by the doctors that work for them now, when it used to be the doctors were working for us. Political Paula, out.